It gives me great pleasure to welcome you all to the launch of the 2024 report of the Lancet Countdown on Health and Climate Change. My name is Smita Mundasid. I'm a reporter and presenter at the BBC covering health and science. And I'm really glad to be back here today at UCL at the Global Institute of Global Health, where I was once a student. I am really looking forward to taking us through the details of this remarkable report. But first, a bit of housekeeping. This event is being recorded, and the recording will be available on this same platform and also on the Lancet's YouTube channel. So a warm welcome to people joining us after the live event too. We're using an interactive platform today, so let me give you a quick tour. First of all, at the bottom of your screens, you'll see multiple tabs where you can find speaker bios, and you can also have a look at the Lancet Countdown report, and very importantly, ask questions via the Slido app, Slido tab. If you have questions for the panel, you can submit them through the Slido Q&A box, and we will try and answer them during the event itself. If they require fuller answers or we're running out of time, we will answer them via email, and all questions are being captured. Let's be reassured of that. We will get to all your questions. Social media. The hashtag for today's event is LancetClimate24. So please use that hashtag when discussing the event and the report itself on social media, and we can all connect there. Looking forward to connecting there with you. Okay, let's get this session underway. This morning, the 2024 report of the Lancet Countdown was, of course, published in The Lancet. It's the 8th annual indicator report, and I don't need to tell you that it lands amidst a time of climate extremes and deadly weather events. At the BBC, my colleagues and I have over the years increasingly been covering the way health is impacted by climate change. But I wanted to share with you a more personal moment this year that really brought home how health and climate change are so interwoven and interlinked. I was in my ancestral village, my granddad's village in South India. It was monsoon, and the monsoon had hit quite hard this year. And I was at a school that I visit frequently, and it's a primary school, and the classes were at best half full. It is normally full of so much noise. In the last classroom that we went to, the kids all had their heads on the tables, were quite listless. And that was the classroom where the kids were waiting to be taken home because they were so ill. And it won't surprise any of you that when I asked the staff what was going on, it was dengue. And then when I went back to the village and was speaking to my relatives and friends there, the parents, they were very worried, of course, about their kids' health. But not only that, but just a few months before that, there had been very high temperatures. And this is an area that really relies on agriculture for livelihoods. And so they had been hit by their health, their livelihoods, financially by this changing climate. We will all have our own experiences of this. And that's why this kind of report is so crucial. So let's move on now to the opening remarks from the Right Honourable Helen Clark, who many of you will know as the former Prime Minister of New Zealand and former head of the UN Development Programme. Helen is also, of course, the chair of the Lancet Countdown board, and she plays a crucial role in shaping the strategy and vision of the Lancet Countdown. Let's hear from Helen now.
Thank you very much, Dr. Mundazad. And let me join you in welcoming everyone to the launch event of the Lancet Countdown 2024 report. Everyone joining us is a busy person, so we really thank you for spending time with us today as we delve into these latest distressing findings on climate change and health, and what they mean for our planet and for each of us, whether we are policymakers, scientists, health professionals, global citizens. I'm, of course, proud to serve as the chair of the Lancet Countdown board, and I know that the ambition of this collaboration is more important than it's ever been in face of the challenges that we face with climate change. Today, the report published in The Lancet warns of record-breaking threats to health and survival. Sad to say, this doesn't come as a particular surprise to us now, after another year of extreme weather events. Just last month, the Hurricane Helene in the US killed more than 200 people. Extraordinary rainfall hit South Asia after a summer where temperatures regularly remained above 40 degrees Celsius through the night. Look at the devastating flooding now in the Valencia area of Spain. Think of the wildfires that have torn through southern Europe. The long list of tragedies from around the world goes on. So we are in a very grave situation. Climate change threats are rising as emissions continue to grow. And it often seems that the many alarms which are being raised by scientists around the world are just being ignored. Yet we cannot afford to continue down this ridiculous path, this irresponsible path. And every moment of delay is being paid for in people's lives and in dashed hopes. Of course, we're also seeing a world in political turmoil. There are some rather critical elections that are still to happen this year, and with climate change denial all too common at the policymaker and political discourse level. But we do find pockets of hope and progress. And I know the Lancet Countdown team has been so careful to highlight the urgent solutions and the opportunities before our world in the report. So over the next period through to 5 p.m. Greenwich Mean Time, we'll be unpacking what the latest evidence means, and we must all resolve to work for it to inform climate action, which will make a real and lasting difference for people and planet. Back to you, Smitha.
Thank you so much, Helen, really reminding us of the long list of tragedies that have happened in recent times, that are happening right now, that we cannot afford to keep going down this path. It is now my great pleasure to introduce us to our next keynote speaker, Dr. Tedros Adhanom Ghebreyesus, the Director General of the World Health Organization. Dr. Tedros has described the modern addiction to fossil fuels as an act of self-sabotage in his efforts to highlight the links between health and climate change. Let's hear from him now.
Dr. Marina Romanello, dear colleagues and friends, WHO is a proud contributor to the Lancet Countdown on Health and Climate Change. Taking action on climate change is a matter of life and death. This year, we have seen the impacts of devastating floods in Africa, searing temperatures across Europe, and horrific storms across Asia and the Americas. Catastrophic events like this were once thought of as once in a lifetime. Now, we're seeing several each year. Our health systems, societies, and economies are under attack from a threat we have created ourselves. Climate change is already having significant impacts on health, exacerbating respiratory disease, heart disease, and mental health conditions. Food production and distribution are being disrupted by extreme weather, as are supply chains for health and other essential products. The need for climate action is urgent. We must transition away from our use of fossil fuels and work with nature to protect our health. I thank the Lancet and the health community for highlighting these important messages and for working with us to develop the COP29 report, which we will take to the 2025 climate negotiations in Baku. I thank the Lancet for producing this vital report, and I look forward to our continued collaboration. I thank you.
A very powerful message indeed from Dr. Tedros Adhanom Ghebreyesus. He says taking action on climate change is a matter of life and death. Our health systems, societies, and economies are under attack from a threat that we have created ourselves. And we will, of course, hear more about this as this event unfolds. Our next keynote comes from an internationally recognized leader on global climate change, an earth scientist by training. Dr. Oyun Sanjaasuren has served as a government minister in Mongolia. She was the first president of the United Nations Environment Assembly, and she now serves as Director of Partnerships and Resource Mobilization at the Green Climate Fund, the largest global fund dedicated to help fight climate change.
Good morning, distinguished guests, colleagues, friends. Greetings from the Green Climate Fund's headquarters in Songdo, South Korea. It is an honor to deliver the keynote address for the launch of the 2024 Lancet Countdown report, which provides a comprehensive and sobering reflection of the escalating health impacts of climate change. This important work highlights a stark reality that climate change is not a distant, abstract threat. It is an immediate crisis that is reshaping the health and well-being of millions around the globe in many ways. The extensive data in this report make it very clear that our window of meaningful climate action is rapidly closing. The cost of inaction is human lives and livelihoods. We know that climate change threatens to undo decades of global health progress and widen existing health inequities. It has increased health emergencies, strained health systems, and worsened the social and economic foundations of good health and well-being. The poorest and most vulnerable populations, especially women and children, remain disproportionately affected. Data in this year's Lancet Countdown report reveal that people all around the world are facing record-breaking threats to their well-being, health, and survival from the rapidly changing climate. We've also learned from the report that out of 15 indicators monitoring climate change-related health hazards, exposure and impact, 10 reached concerning new record highs. Despite years of scientific evidence exposing the imminent health threats of climate inaction and numerous global commitments and pledges, this report highlights that countries and companies continue fueling the fire, reversing the limited progress made so far and exacerbating inequities. Years of delays in adaptation initiatives, alongside persistent investment in fossil fuels, unfortunately, are reducing the chances of mankind's long-term survival. The financial resources that should go to support this transition, and they are available financial resources, are unfortunately being allocated to activities that perpetuate fossil fuel-based economy. Resources must urgently be redirected away from activities that hinder a just transition to net zero, i.e. to low carbon or carbon neutral systems, towards sustainable systems that benefit people's health and well-being. The Green Climate Fund understands the critical urgent link between climate change and global health. This year, GCF launched the world's largest readiness and preparatory support program to access climate finance from developing countries, and that will open opportunities also for countries to conduct health and climate diagnostics, among other sectors, but also develop national adaptation plans that can include health national adaptation plans. This assistance is critical for countries to lay down foundational long-term strategies to address climate-driven vulnerabilities in various sectors, and that should and must include health sector. We're happy to report that GCF also invested $70 million in health-specific climate action projects in Laos, Cook Islands, and Malawi. GCF's health and climate pipeline for the next 3 years includes 4 substantial country proposals at this stage for Malawi, Togo, Senegal, and Micronesia, and 3 multi-country programs that could unlock more than $500 million in new climate health adaptation and mitigation spending. GCF also promotes greater collaboration between the public sector and private sector for climate and health initiatives. At COP28 last year in Dubai, GCF co-endorsed, together with other partners, guiding principles for financing health and climate investments. As you probably know very well, these principles call for greater coordination, alignment, and complementarity in climate and health investments among the funders. And finally, over the past year, GCF explored a joint investment framework for climate and health financing with the World Bank, the Global Fund, and the Rockefeller Foundation. GCF is strengthening Malawi's health system against climate shocks through co-investment with its valued partners, the Global Fund and the Rockefeller Foundation, and we're very happy to report that yesterday our board approved this new project for health and climate in Malawi. We're also looking forward to more country-level co-investment that have been mapped out for Togo, Senegal, Somalia, South Sudan, Zimbabwe, Lesotho, and Eswatini, and we're looking also for other countries to come on board. In closing, let this important report be a reminder to all for the need to act decisively on climate change with the urgency this global crisis demands. Many thanks.
A series of very important reflections there, including the extensive work of the Green Climate Fund. Dr. Sanjaasuren said the extensive data in the report makes clear the window for meaningful climate action is rapidly closing, but the cost of inaction is, of course, human lives and livelihoods. We're going to go into that data next, but first, a reminder of the hashtag for everyone posting on social media about this event and the report itself. It is Lancet Climate 24. Now, I'm delighted to bring us to a crucial moment in the agenda where we can really dive into this year's report. Dr. Marina Romanello is the Lancet Countdown Executive Director. This year, she's brought together 122 leading experts from 57 global academic institutions and UN agencies to deliver the Lancet Countdown report, which shows we are facing record-breaking threats of delayed action. Dr. Romanello, over to you.
Thank you so much, everyone, for joining us. Thank you for being here. I'm delighted to share with you some of the findings of the report that we've only just published in the Lancet. You will shortly see on screen the front page of that report. The title, very telling, is that we're currently facing record-breaking threats from delayed action. This year's report comes at a crucial moment where we're seeing the growing threats of climate change on people worldwide. But it's the 9th report that the Lancet Countdown has published, and it's the 8th report with annual iterations of the data that we've been producing. This report has been produced with the contributions of 122 researchers from 57 leading research organizations and from UN agencies worldwide, in close collaboration, as you've already heard from Dr. Tedros, with the World Health Organization. And it's the most concerning report that we found in our 8 years of monitoring. As Oyun already anticipated, we're seeing that in the indicators in which we're monitoring the health threats, the hazards, the exposures, and the impacts of climate change, out of 15 indicators, 10 have reached record high new levels of threats. This means that our health is increasingly at risk. And as you can see in the screen, that heat map shows you each of these indicators where we've represented their values, from blue being the ones that are safer conditions for health, to red, that is the worst conditions in our assessment. And you can see that very clear trend towards redder, worsening conditions. Across every indicator, we see that the situation is getting increasingly more challenging for health in every dimension that we're monitoring. And one of the key impacts of climate change obviously comes from extreme heat and from heat exposure. As the temperatures rise, we see that the threats to our health associated with high temperatures is also growing. And this is particularly so for vulnerable groups like very young children, pregnant women, people with underlying health conditions like heart disease, lung disease, and adults, elderly people over 65 years of age. And what we're monitoring here is heat-related deaths of this vulnerable age group, people over 65 years of age. And we see that it has reached mortality 167% higher levels than in the 1990s. And importantly, this is more than twice the level of increase that we would have expected if temperatures hadn't changed. So we know that it's climate change that is driving this rapid growth in heat-related mortality to record high levels this year. But obviously, mortality is just the tip of what we know is a very big iceberg of health impacts of climate change that is associated with worsening health conditions, with morbidity, with disease associated to heat stress and to other health conditions that are worsened by rising temperatures. And if you look at the report, you will see that we're monitoring the increased exposure of people to high temperatures is limiting labor capacity. One particularly concerning finding this year is that we've reached record high level of losses of labor hours in 2023, and that has led to 835 billion US dollars being lost, almost 1 trillion of US dollars being lost because of this heat exposure. That is not only the health costs of loss of livelihoods, of loss of income, but the direct economic losses that we're facing because of our inaction. But obviously, heat exposure is just one of the variables that is being changed by climate change and by our growing greenhouse gas emissions. We're also seeing that precipitation patterns are changing, rainfall patterns are changing. And as a result, we're seeing a rapid growth in the land area that is exposed to extreme precipitation days. We see that over the last decade, 61% of the global land area saw an increase in the average annual days of extreme precipitation compared to past decades. And what this means is that we're increasingly seeing those days in which we see an enormous amount of rainfall that increases the risk of floods that are the second most deadly climate event that can lead to drowning and to direct injury. We're also seeing an increased risk of exposure to contaminated waters, to sewage waters, and disruption of our sanitation services, with the increase in the risk of infectious disease transmission that comes with that. As we speak, Valencia in Spain is seeing a deadly flood event that has come from the year's worth of rain falling in just one day. And that is exactly what we're seeing in our data. That is what this 61% increase means, more and more of those deadly extreme rainfall events and the flooding that comes with them. But this extreme rainfall often occurs at the same time as we see many parts of the world that are increasingly exposed to extreme drought events. So because of the change in precipitation patterns, the conditions are becoming more unstable and more extreme to both ends. In 2023, almost half of the world's total land area was affected by drought at least 1 month that year. And this is up from just 15% in the 1950s. You can see in the map, those red areas show you particularly affected world regions like Africa, north of Africa, and the Horn of Africa, where we know that a human-induced drought has contributed to exacerbating the local hunger situation. In South America, in Brazil, we've seen the Amazon suffering from this drought. We've seen rivers getting drier. We've seen that has disrupted lives and livelihood, and it has even isolated communities that rely on river flows for transportation. So the impacts of this drought can be multidimensional. They can increase the transmission of infectious diseases, disrupt the production of food, and lead to increased food insecurity. They can worsen also access to clean water, and that has multidimensional impacts on people's health. And with all of these changes in temperature, in precipitation, what we're seeing is that the environmental suitability for the transmission of key deadly infectious diseases is also changing. I'm giving you here 2 examples. We have many more in the report. But what we see is that in a year in which dengue cases have reached record high levels, climate change has increased the likelihood of transmission of dengue, adding fuel to the fire. The transmission of dengue by Aedes albopictus, the most widespread vector of dengue here in Europe and also in some parts of Asia and other parts of the world, has increased by 46% since the 1950s, and that for the transmission by Aedes aegypti, the most widespread vector in places like South America, some parts of Asia, Africa, has increased by 11%. And this is not only vector-borne diseases, but as you can see on screen, it's also for waterborne diseases. As an example here, the transmission of Vibrio pathogens that has also increased in likelihood because of the warmer coastal waters. We've seen in 2023 a record high 692,000 estimated cases of Vibrio. These are infections that lead to gastrointestinal infections, but also severe wound infections that can lead to sepsis, sometimes called the flesh-eating bacteria. So these are very serious conditions. And all of these impacts are happening simultaneously. You can see in the report all of those kind of 15 indicators that are getting worse, putting people's threat and increased risk, adding extra pressure to our health systems, which are often not prepared to deal with this level of threats. But what we find with great concern this year is that despite years of monitoring and of raising the alarm, despite all of the different reports of the Lancet Countdown and other scientists that have put forward the enormous urgency of addressing climate change for a healthier future, we see governments, companies continuing to fuel the fire of climate change, increasing the risk to people's health and to people's survival. One of the new indicators in these reports monitors an aspect that we hadn't looked at in as much depth in previous years. That is the loss of tree cover that we're seeing since 2001. We've seen over 459 million hectares of tree cover loss, 11.5% of all of the global land cover being lost. And this means that we're reducing the world's capacity to absorb the heat warming gases that we keep on pumping to the atmosphere. This limits our capacity to tackle climate change enormously, but also it reduces the tree cover, it reduces the biodiversity that is so essential for good health. It also reduces the human exposure to trees and to green areas, which is so fundamentally important for physical and mental health. And when we look at the cause of this tree cover loss, the main drivers are forestry, mismanaged forestry, but the second biggest driver is shifting agricultural practices. And this is where the links with climate change and with health become very close, because we know that our unhealthy meat-intensive diets that particularly in high-income countries are too rich in red meat products and dairy, are also associated with high levels of greenhouse gas emissions and also with high land use. So that land-intensive diets that we're consuming is one of the big drivers of the loss of tree cover that we're seeing as well. And obviously the other sector, which is crucial, is the energy sector, the biggest single contributor to global greenhouse gas emissions. Unfortunately, although we have the technology, although we know how to transition our energy systems to zero carbon emission, we're still seeing that energy sector emissions are growing year on year. They've reached a record high level in 2023. According to data from the International Energy Agency, they are in 2023, 1.1% above the 2022 levels. So we continue to add and emit greenhouse gases to the atmosphere, which accumulate there and continue to heat our planet. And we're not reducing the carbon intensity of that energy production, which means that we're still enormously reliant on fossil fuels to meet the world's energy needs. And that has several implications for health, not only the worsening of climate change, but also more directly, the persistent dependence of families and households on dirty, polluting fuels to meet the fundamental energy needs. Globally, 2.4 billion people still rely primarily on dirty fuels and technologies to meet their energy needs. And 30% of all of the households around the world are still using biomass, a very unreliable, very dirty source of fuel, a value that grows to 92% of households in low human development index countries. These are the poorest, the most vulnerable countries in the world. So this is a symptom of energy poverty. And the direct health impact of that, beyond the health harms of energy poverty, is that people are also being exposed to toxic air inside their homes because of the persistent use of solid fuels to meet energy needs. We estimate that in 65 countries alone in 2020, there were 2.3 million deaths associated to indoor air pollution from the burning of solid fuels. And as you can see on screen, rural households are disproportionately affected, exposing the intra-country inequalities that come from lack of access to renewable energy. These 2.3 million deaths are entirely avoidable if we were to transition to reliable, renewable energy that can be offered off-grid to remote communities that can be much more affordable in many cases than fossil fuel-based energy. The other important consequence of the persistent reliance on fossil fuels has come at a huge cost to our countries, to our national budgets. Following the war in Ukraine, there was a huge spike in fossil fuel prices. We often felt that in our own pockets, but countries have been trying to keep energy prices low, to keep energy affordable and avoid an increase in energy poverty that would have come with that soaring in energy costs. And this is the direct consequence of continuing to depend on volatile fossil fuel markets to meet countries' energy needs. In 2022, 84% of the countries were still allocating overall subsidies to fossil fuels. The cumulative total they allocated to fossil fuel subsidies rose to $1.4 trillion, a record high level. It dwarfs any sort of commitments that have been done for climate action. These funds could be redirected to supporting the so much needed just transition to enable a healthy, livable future. It's more than has ever been committed for climate action. And to put it a bit more in perspective of what this means, in 27% of the countries, the total amount allocated to fossil fuel subsidies exceeded the total national health budgets at a moment when strengthening our health systems has become so crucial. These funds could be easily redirected to supporting people's health, people's livelihoods, a transition to a healthier energy system, and making energy affordable for all. Now, behind this is obviously a persistent expansion of our fossil fuel dependence and our fossil fuel activities. And fossil fuel companies have a big role to play. With very big concern, this is probably one of the most concerning findings. We're seeing that 114 of the largest oil and gas companies have collectively expanded their oil and gas production plans, going against all of our commitments and efforts to tackle climate change in agreement with the Paris Agreement's goals. By 2040, they are currently on track to exceeding the levels of emissions compatible with keeping global mean temperatures to 1.5 degrees by 189%. This is even higher than 1 year before, when they were on track to exceeding them by 173%. So oil and gas companies keep on expanding their production plans, increasingly jeopardizing people's health and people's survival. And what happens with this expansion is that we're increasing the value of those assets, of those fossil fuel production assets that have no space and no room to operate in a world that enables a livable future. And those assets will be lost because we will manage to deliver a livable future. We will keep climate change under control. And what we're seeing so far is that the losses of current assets are amounting between 2025 and 2034 to get up to $164.5 billion. This is the losses of investing in an economy that has no space in a safe future. And concerningly, we're seeing that this number, these economic losses, are probably going to keep on growing, because we're seeing that since 2020, investments in the fossil fuel sector have continued to rise. They're now at $1.1 billion annually. This is less than all investments in renewable energies, but it's still promoting the expansion of fossil fuels. The more we invest in fossil fuels, the more stranded assets we will get, and the more our economies, on which our health, our well-being depend, will be at risk. We know that we have enough funds going around to support the healthy energy transition, but this requires political will. And concerningly, since 2021, we're seeing a decline of the engagement of world leaders with the links between health and climate change. And we see this in their UN General Assembly speeches, where mentions of health and climate change have fallen from 50% of countries making this reference in 2022 to just 35% of countries making these links in 2023. So this tells us just how important it is that we keep on raising our voices, that we keep on advocating for climate action that protects people's health, because we do need every country to be paying attention to this crucial interface between climate and health. So the findings in this report, as you probably tell, are quite worrying. But we do find some signs of progress. And these are very important because they direct us to the efforts that need to be strengthened and to the opportunities that we have to deliver a healthy future. We're seeing in the energy sector some signs of progress. The adoption of clean renewable energy is growing really rapidly. It's still not evenly distributed, but it is growing. And we're seeing that the percentage of global electricity that is generated from clean new renewables like solar and wind energy has reached a record high of 10.5%. This pace of increase needs to continue, and we need to ensure that these new technologies are available and affordable by the communities around the world that are still struggling with energy poverty. And we're also seeing that the economic transition has led to the creation of jobs in the renewable energy sector, reaching a record high of 13.7 million people employed directly or indirectly in the clean energy industry, exceeding all total employment in the direct sector of fossil fuel extraction and production. This is very important because it means that we're generating job opportunities that are viable, that can persist in the future and can afford people's livelihoods as we move to a healthier climate. And one of the most encouraging and greatest findings of this year's report is that since 2016, we have managed to reduce the air pollution related deaths that come from fossil fuel pollution by almost 7%. And that about 60% of this decline is actually because we've managed to reduce somewhat the pollution that comes from coal burning. So this tells us that by phasing out fossil fuels, by phasing out coal, we could be saving millions of lives every year. And this is proof that that change is actually possible. Finally, another great area of progress that we find in this year's report comes from the health sector. Driven not least by the enormous work of the WHO and the work that the Alliance for Transformative Action on Climate and Health has been doing, we've seen a huge growth in the engagement of the health sector with climate change. And increasingly, countries around the world are starting to respond and to get prepared to provide better healthcare for people that are exposed to climate hazards. As you see on screen, the number of countries that have reported having developed their vulnerability and adaptation assessments, essential to understand where climate action and climate adaptation is necessary, has increased from 11 to 50 countries. And the number of countries that have developed a health national adaptation plan has increased from 4 to 43% in 2023. We obviously need this to be 100% of all of the world's countries, almost 200 countries, but this change is really encouraging, and we hope to see much more of this in the future. So with these trends, with some of our findings, with this year's report, we have put together some of the new opportunities that have emerged over the past year with new developments that are really encouraging. So we have plenty of short-term opportunities that we really need to act on today to support the transition to a healthier future. Firstly, countries are due to updating their nationally determined contributions, their climate commitments to the Paris Agreement by 2025. And that gives us a huge opportunity to ensure that those commitments are ambitious, that they lead to the reduction of greenhouse gas emissions, and that they lead to the improvement of health and well-being. We have also seen that there's more than plenty of finance going around. It's just being generally allocated to supporting the expansion and perpetuation of fossil fuels. And those funds, those trillions that go to fossil fuel subsidies and fossil fuel investments, could be redirected to support a healthier future, to support the transition to clean energy, to improve energy access, and to keep energy affordable. We've also seen big improvements and new opportunities coming from the WHO itself. The WHO's new General Program of Work 14 has put tackling climate change as its first strategic priority, which gives health systems around the world the opportunity to deliver climate-resilient, low-carbon health systems. And we're also seeing that in the UNFCCC itself, there's plenty of new opportunities to ensure that health is prominent in climate negotiations and that drives the ambition of climate action. So with that, I thank you so much for your attention. I wanted to thank especially the 122 authors that have contributed to this year's report, that have worked tirelessly to get the data out to you. Particular thanks also to the Lancet Countdown team for the hard work that's been going into this, to the Lancet, and obviously to the Wellcome Trust who has funded this work. And then back over to you, Smita.
Thank you so much, Dr. Romanello, for taking us through that extensive report. And thank you so much too to the 122 people behind all of this research, which really highlights and draws attention to just how climate change and health are interconnected. It was very sobering indeed to hear you say that this is the most concerning report in the 8 years of measuring these indicators. There were some very, very big numbers that have big impacts on individuals and often vulnerable individuals. Some really struck with me, and so I'll just go through a couple that stuck with me. Globally in 2023, people were exposed to, on average, an all-time high of 1,512 hours of high temperatures that posed at least a moderate risk of heat stress while doing light outdoor exercise. In the same year, increasing temperatures also led to a record 512 billion potential hours of labour lost globally, with a global potential income loss equivalent to 835 billion US dollars. What big numbers, what a huge impact. But there were some reasons to be optimistic too. Deaths from fossil fuel-derived air pollution fell by almost 7% from 2016 to 2021. Employment in the renewable sector reached a record high with 13.7 million employees. That's a huge growth in that very important sector for a livable future. Please keep the questions coming in the Q&A box in the tabs at the bottom of your screens. I know there will be many, many questions and many points of discussion from that very extensive report. It brings up crucial things that need urgent consideration. And so let's move now to the panel discussion. The Lancet Countdown is published every year, of course, in the Lancet Medical Journal. And it is my pleasure to now invite the Lancet's editor, Richard Horton, to facilitate the panel discussion.
Smita, thanks so much. It's wonderful to be with you all again for our annual event. Marina was very generous in thanking a lot of people, so let me thank Marina for her amazing leadership of the Lancet Countdown. Thank you, Marina, because one of the indicators of the countdown is media engagement on all of these issues. And when I turned the radio on this morning, there it was. The countdown was almost top of the charts in terms of the importance given by many news organizations to the issues of the day. And that really is a stunning success after almost a decade of activity. There's a lot in this report, as you've seen from Marina's presentation. So I would just like to put in a word for an incredible infographic which appears on the Lancet's website, freely available to you. Download it, cut it up into your favorite statistic that you can carry around with you and remind yourself of. It really summarizes the report extremely well. When you logged on to join this webinar, you were invited to give a word to summarize your thoughts about this current situation with climate change and health. And we've got a wonderful word cloud giving your priorities, words like commitment, justice, health, and progress. But the one word that was the most common of all was the word action. And that's the real underlying message of this year's countdown, the importance of action given the record-breaking levels of crisis that the countdown describes so well. So keep your questions coming in. And what I'm going to do now is come to our wonderful panel members. I'm going to introduce them one by one, and then we're going to hear from a minute or so from each of them. First, we have Dr. Omnia El Omrani, who is the COP28 Health Envoy, and she is the first youth envoy to the COP27 president. Welcome, Omnia. Dr. Gitinji Gitahi, Group Chief Executive Officer of AMREF Health Africa, speaking to us from Nairobi. Professor Patrick Verkuyen, who is the Chief Executive Officer of the Global Center on Adaptation. Dr. Maria Neira, who you all know so very well, an incredible leader on health and climate, Director of the Department of Environment, Climate Change and Health at the World Health Organization. Welcome, Maria. And the indefatigable Dr. Marina Romanello, our Executive Director of the Lancet Countdown. So I'm going to start with you, Omnia. A minute or so on your immediate reflections on what you've heard so far.
So first of all, congratulations on this incredible launch. I've also been seeing my Twitter feed a huge amount announcements around the report supported by the UN Secretary General as well. And one of the most critical findings I saw in the report is around the delayed action part. We have seen, particularly in my capacity as the health envoy, that COP28 had a big health momentum with the declaration, with the pledges, and yet we still see a delay in action, which is particularly impacting children and young people the most. As the report showed, that children's development is being affected by fossil fuels expansion and contribution to the global energy system. In the report also, it highlighted how dirty cooking fuels are also impacting the health of children and women, with less than 13% of low-income countries having access to clean cooking fuel. But alternatively, we can also see how within the healthcare systems, there is an increased commitment towards action, towards reduction of carbon emissions, and through WHO's attach mobilization, but also through education, which I encourage people to also check that within the report, and how public health institutions are integrating climate change to further increase the capacity and mobilize further young health professionals to be the advocate for the climate and health agenda's implementation.
Thanks so much, Omnia. And absolutely, we want a new generation of climate activism. And if we're really going to make the generational progress that we all crave for. Let me move now to Dr. Gitinji Gitahi. Gitinji, welcome.
Thank you, Richard. And thank you very much to Marina and to the Lancet Countdown for that report. And I think my take out on this, especially coming from Africa, is that it's going to be a long time of the health system suffering the impact of what has already happened, because the change that we are looking for, whereas it's starting from that report, it is going to take a long time to see sustainable change that is going to bring down the risk on an already suboptimal health system from where we come from. So for me, I look at that report and I say, well, we need to double down on our adaptation plans, because despite the fact that the continent from which I come is contributing only 1 metric ton of carbon equivalent per person, and countries that are contributing up to 14, 15 metric tons per capita, those 15 tons are going to continue increasing the precipitation, the extreme rainfall, the extreme climate events. And therefore, we have to double down on adaptation plans, because the impact is here, is going to be here. It's no longer a risk, it's a reality. That's what I see from this report. And therefore, we have to think about health adaptation plans in every country, in our continent, to ensure that as we wait to turn the arc, we protect lives. And therefore, for me, from this report, this is not a climate crisis. This is a life crisis. Back to you, Richard.
Yeah, fantastic. Gitinji, thank you for that. It is indeed. And just to say that as we look over the course of the 21st century, the adverse health effects are increasingly going to fall on Africans, just simply by demographic change. By the end of the century, one in 3 people on the planet will be from the continent of sub-Saharan Africa. So really, really important message. Professor Patrick Verkuyen, very much pleased to welcome you to our panel. Give us your reflections in a few minutes, please.
Well, thank you so much, Richard. First and foremost, congratulations to the team for this very comprehensive report. My 3 takeaways are as follows. 1, as also Prime Minister Helen Clark indicated, we're not just in a climate emergency, but in fact, we're in an adaptation emergency, because obviously mitigation is critical. But I mean, we're now in a reality where we have to adapt or die. I mean, that's sort of the bottom line. We all live in the eye of the storm of the climate breakdown. But as the previous speaker indicated, Africa is ground zero. That's point 1. Adaptation has to be front and center of the action agenda. 2, within that, it's obviously clear that health should be the front and center within the adaptation agenda. But quite frankly, Richard, my takeaway is health, in essence, is MOI, is missing in action. Yes, indeed, it's great. We see them sort of a tenfold increase in planning. But the third key message is, what is planning without financing, right? We need to fix the adaptation finance crisis. Just give me sort of a reality check. How much finance is flowing today to sub-Saharan Africa on adaptation alone? It's $10 billion a year. How much funding needs to go to sub-Saharan Africa on adaptation alone? It's $100 billion a year. So it's a tenfold increase. So the reality is, adaptation, we're moving, not fast enough. Health is there in the planning stage, but not in the action phase. And we need to fix the finance crisis. That's, Richard, that is why it's so important to have this report today, a week out before COP29. Final message, in 2021, the world promised to deliver the doubling of adaptation finance by 2025. We're very far away from that sort of implementation. So it's great to negotiate the post-2025 financing goal, but I would say let's also not forget what we already have promised in the past. Doubling adaptation finance and health should be at the center.
Thank you, Patrick. And that's a bracing few words and important words, because we're feeling quite good about this report, quite pleased with the coverage that it's got. But your message is one of don't be complacent if health is missing in action in the policy agenda. So thank you for holding us accountable and not letting us rest on our laurels here. Dr. Maria Neira, Maria, it's lovely to see you. You've done so much in the leadership of WHO over the years. What are your reflections today on the report you've heard about so far?
Thank you, Richard, and thank you all. No need to say that I agree with all the comments made until now. I think all the conclusions are fascinating. Big thanks and big congratulations to all who contributed to this. My take from this is, what is the plan? Because we need a plan now. No excuses regarding the evidence. I think we need to make sure that no politician, no Minister of Health, no Minister of Energy, no one who is able to take responsibilities will have the excuse to say, I didn't know. Now the evidence is there. So the next step is, so what do we do? And we need to tell everybody that any action you take, any climate action is a health action. Whenever a mayor of a city, whenever a local manager is taking a decision on the sustainable transport system they are putting in place, this is a health decision. Climate action is a health action. So we need to use this positive argument. Whenever we vote as individuals, if we vote in the right direction on policies that will protect our health, this is a good health action as well. Whenever we take decisions and mobilize the community, the youth, but we don't need just activists. I think now is more than activism. It's an activist with a very strong action. We need a kind of, I have a dream, but I have a dream with a very strong plan. I think you heard me saying that before. So I
personally, three things. I want to keep on the political level, G20, where I am now, the COP29, of course, and all the COPs that I hope one of these days we will stop to entertain COPs and we will take real decisions. I want to push all the channels we have on mobilizing the political attention, but I want as well to create a very strong popular movement. We need to popularize and glamorize this action and make sure that people will understand that climate action is health action. So they need to, all of them, whenever they recycle, they need to understand that they are contributing to that. And of course, the third thing is money. Not only channeling funds, but as well using those funds on a very strategic way and addressing the problems on a very tactical as well. So all of those are the priorities. And I think now, what is next? What is the plan? This is my question. We need to start to create this action and this movement that we all needed.
The plan.
No regrets. The plan is to put pressure on politicians and policymakers, mayors, governments, everyone with the non-excuse argument. The second one is the non-regrets. We need to tell them that whenever they invest on the transition to clean sources of energy, they are investing on the health of the people. We need to create a movement of society and popular people that understand that this is something that is affecting their health. And I'm convinced that maybe health is missing action. It's painful to hear it, but maybe it's right. But I think ATTACH and the health professionals are now mobilized, and they wanted to use a positive argument and demonstrate that, after all, I think only health can take us out of this, because health is the most motivating and powerful argument. So maybe if we keep pushing, that's next.
Thanks very much indeed, Maria. Fantastic. Marina, do you want to comment on yourself?
Well, I've already spoken quite a bit about our findings, but it was just kind of getting all the energy, the action energy that is coming from the other panelists. And I think that's exactly what we need. We've done all the words, we've done all the warnings. It's a moment in which we actually have to take action. So it's so important that we focus on that. And as Patrick said, kind of health is sometimes missing in action. And it's not only about the impacts of health itself. I often hear, and I get a lot of tweets about this, about how we want to jeopardize the economy. And the interesting thing is, climate action will be enormously positive for the economy, if anything, because healthier societies, healthier populations, a healthy workforce is the best economic outcome. And because we've seen the enormous economic returns that could come from expanding that kind of clean energy section of the economy, from clean jobs, from giving access to energy to remote areas. So I don't think we have any more excuses for inaction. And all of this is just, as we say, fake news. We have to actually lean on the evidence.
Thanks, Marina. Now, what I'm going to do with the panel is I'm going to take you through three areas that are the three top line findings of this year's report, and just invite you to answer perhaps one or so questions about each area. Now, the first major finding of this report, which is represented in the title, is all about the record-breaking threats to health, well-being and survival from the climate emergency that we're facing. So what I'd like each of you to do, please, is to give some examples of the health impacts that your organization is seeing. So let's make this real for people in terms of what you're observing. So perhaps we could start. Omnia, would you like to begin?
Yeah, absolutely. So I'm based at Imperial at the Climate Care Center College, and we focus on the impacts of climate change and mental health. And we had a global initiative across 90 plus countries with over 960 experts to understand how does climate change affect the mental health of their communities. And what we have seen that farmers are expressing depression, as well as increase in suicidal thoughts because of attempts, because of crop failure driven by drought, as Marina demonstrated. But what we've also seen in young people, how climate-related disasters is leading to increased anxiety, post-traumatic stress disorder, but also fear, anticipatory fear of the future, but which is also related to the lack of their meaningful engagement in the climate decisions that are being made and affecting them the most. We've also seen how Indigenous communities and our lived experience advisors who are experiencing grief because of loss of their land, of their culture, and at the same time, they have contributed the least to the drivers of these impacts on their homelands. And we have the lived experience stories on our hub, which shares how the different vulnerable groups, but also the experts, and how they also curated their own solutions to not only invest in protecting the land and the planet, which their health depends on, but how investing in people's resilience can enable them to absorb the shock of climate impacts, but also lead their own climate solutions.
Thanks, Omnia. Brilliant answer. Patrick, I know you have to leave us a little early, so I'm going to jump to you. Health impacts from your perspective.
Yeah, so Richard, you talked about threats, and one of the previous speakers also spoke about to glamorize the climate action agenda. If I think about threats, I think about the flip side, opportunities. If I think about impacts, I think about, okay, what can be done? So we at the Global Center on Adaptation, indeed, we are the only international organization exclusively focused on adaptation. We work particularly in Africa, and we're global, but with a deep dive in Africa. We have the largest adaptation program in the world. In Africa, $12 billion. But what's happening on the ground, Richard? Well, let me give you an example. Mukuru. Where is Mukuru? Mukuru is an informal settlement in Nairobi itself, right? These people, they're living on the very hardship conditions, but they know what the threats are. They know what the impacts are because they live on the front line of the climate emergency. So what we have done with the people of Mukuru to co-develop with them in the front seat, to develop a people's adaptation plan. The health component was front and center, but the same argument applies, as I also indicated in the report of Marina. It's great to have a people's adaptation plan to articulate the needs for the people of Mukuru. How do we link it to the financing? And that's exactly what we do in Africa. We link local programs with large-scale financing of the international finance institutions, whether it's the African Development Bank, whether it's the World Bank, even the policy reform package of the IMF. I think that's where the trick lies. Linking bottom-up action with global financing, that's the sweet spot, that's the exciting space to be, because exactly, it is about the economic imperative to invest in adaptation. It can be done, let's get on with it.
Thanks, Patrick. I love the idea of a people's adaptation plan. That's really great. Gitinji, let me come to you. Health impacts from where you're sitting.
Thank you. And I want to pick up from where Patrick left, that people don't just wait. People actually respond to the daily threats of their lives. Patrick wrote about Mukuru. You can think about Kibera slums in Nairobi, where people know that flooding is going to happen and they create their own response. We may not call it an adaptation plan, but they actually have a plan of the people to respond to the flooding that they're expecting when they have the data. But to respond to this question of health threats, I'll give you just 3 examples of what we are seeing. I'll give you an example of a recent flood that happened in Kenya in February this year, and about 51 people died. That was the last count, overnight, because of a dam that broke upstream and swept the people overnight and their livestock and everything down there. Not dissimilar to other flooding that is happening elsewhere, as has been spoken about by other colleagues. But what makes this a significant difference? It is because the women and children and men who got washed away this night will not understand climate change. They don't understand the conversation we are having here. What they know is that there was extreme rain and they were washed away, and there was no health system to respond to the emergency that night. Why was there no health system? It is because generally in African countries, the health investment will be best at $40 per capita, $40 per person per year, whereas in countries, in high-income countries, where the emissions are coming from, where the emissions are 14 metric tons per capita, are actually spending almost $4,000 per capita on health from tax money, from their government. So from the one thing I would like to say is that the impact on health is that it's increasing our health costs that are already suboptimally low, but because now you have to take care of new threats, it is reducing the available resources for women and children, for vaccination, for antenatal care. So there is a major systems failure that's going to get worse. The next thing is that this failure is going to be compounded further by recurrent pandemics. We know now that Rwanda has just been doing a fantastic job responding to a Marburg virus outbreak. And this hemorrhagic fever is related to bats, fruit bats. And we know that the outbreak is not, climate is not innocent in this particular outbreak, as happened in Tanzania last year. But we know that these threats are going to increase, and they are increasing. And the same for Mpox. In a country where Mpox outbreaks are increasing, in a country where per capita contribution to carbon metric tons is 0.05, a person in DR Congo will take up more than 280 years to emit the same carbon as somebody in Europe or the US. And therefore, they don't see it as a climate crisis. They see it as a life crisis. Finally, to say, as AMREF, we've been working on the One Health. And one last incident I want to mention is recently collecting data from communities on weather, on health, on what's going on the ground. We discovered, death of livestock, sickness of human beings. And when we look at the data, it was clear that there was a lake that was drying up, and the algae were getting concentrated, and the nitrites were concentrating, and this was becoming poisoning source for livestock and human beings, and we had to respond to this. So these are daily occurrences, whether they are showing up in data or not, and that's why I said this is actually not a climate crisis, this is a life crisis.
Thanks, Gitinji, and I'm really grateful to you for making the interconnections between some of these different global health crises with the pandemic preparedness, for example. Really important that we do make those interconnections and that we don't work in our separate silos. Thank you. Maria, health impacts.
The moment we are talking, actually, I wake up this morning with news in the radio that Valencia, in my own country in Spain, was terribly affected by extreme meteorological events and flooding and a lot of suffering. So I think it's important as well to give examples of how so-called wealthy countries with an infrastructure, countries that are better prepared, they are suffering as well the impact of climate change in form of these extreme meteorological events. It will take a while now to these people to recover, in addition to, of course, the mortality. At the moment we are talking, I think there are 63 deaths, but they are still counting, and the disaster is terrible. But of course, one of those clear health impacts of related to climate change and is probably having a huge impact in the health of the people is air pollution. As you know, again, at the moment we are talking, and you have people breathing air that shouldn't be called air, because it's something toxic, but it's not air. It's not something that you need for your survival. More than 90% of the global population is breathing toxic air that are killing us. And this is so much related to climate change. And this is where the argument of transitioning to clean sources of energy is so much needed, because it will contribute to mitigate the causes of climate change and the causes of air pollution, which is such a dramatic public health issue. And of course, I think we are all thinking on the heat waves. A couple of years ago, I was in London with around 40 degrees Celsius degrees, and everybody was panicking. So I think that put us all in context of the importance of being resilient to climate change, investing, of course, on adaptation, but investing on something that it should be common sense, because what we are asking is to invest on water and sanitation, on removing the toxic from the air we are breathing, on making sure that we are better protected from pandemics because we create these green walls. So all such a no regrets investment that I still don't understand why we are not doing more with more ambition and with a different speed.
Thanks very much, Maria. And Marina.
Well, Richard, look, I was asked very recently in an interview of these health impacts that have reached record levels and whether they surprise me. And the answer is sadly no. And sadly, we will expect record high levels of impacts in upcoming years as well. We know that climate change is worsening. We know that it will continue to worsen. But I wanted to give you an example from where I am, from back in Argentina. We had the worst dengue outbreak last year. And it was not only the dengue outbreak, which was exacerbated by a particularly hot April. It was also the fact that because we had not prepared and we hadn't foreseen such a big dengue outbreak, there was no mosquito repellent to be found anywhere. I know so many people that got dengue, my friends, my family. Dengue was a faraway disease when I was young. So this is coming home for so many people. We're seeing the spread of infectious diseases. And it's not just the problem of dengue, it's the problem of the whole disruption that it generates. So that's why adaptation and preparedness is so essential. Sometimes people are much better at adapting than governments can do top down. So leaning also on the power of communities is important, but we have to deliver finance for adaptation and we have to mitigate climate change, because the more the planet heats up, the worse the situation will be, and we will break all of the possibilities of adaptation. We will go way beyond our adaptive capacity.
Thanks very much, Marina. And your example of dengue shows that unfortunately progress is not inevitable unless we really make an intentional action to do something about whatever the threat is, in this particular case, climate. Patrick, I'm going to come to you for the next set of questions because I want to move on to the next top line message of this year's report, which is about the fact that countries and companies are fueling the fire and unfortunately reversing the small amount of progress that has been made so far. And in addition to reversing progress, actually worsening many of the inequities that exist. So again, from your organization, has Patrick left?
I think we've lost Patrick, but I'm checking, Richard. I think you have just had to jump off. Yeah.
Okay. Well, in that case, I will leave this as an open question for all of you. Given that we're fueling the fire, all of the delays that we're seeing in adaptation, the new records in fossil fuel emissions, it feels pretty bleak. And I just would like you to speak again from your perspective, your organization's perspective, the trajectory that we're going on. Discuss. So maybe let's start with Gitinji this time.
Thank you very much. I saw Omnia there smile when you didn't start with her. So I'll take one for you, Omnia. And I think the point here is that looking at those slides, it's more profitable to pollute than not to pollute. This is the problem that we are seeing with private sector. It's a market system issue. And it's not only market, it's not only private sector, with everyone, with governments, that is more profitable to pollute. And therefore, before we turn the tide, we have to pollute and pay. We have to stop polluting. And if we pollute, we have to pay. And I think we have to go back to the conversations because market systems respond to market incentives and disincentives. And I think this is what the world has refused to do. It's refused to use market tools to change a market problem. And this is what we have to do, to use market tools to change a market problem. And that's why the loss and damage, carbon taxation, are extremely important. And this means that even as we look at, taking health at the center, the people will nod, they will agree. But unless there is a disincentive to continue using fossil fuels, we are going to continue seeing this same problem. So this is my view, Richard, that we have to use market tools, market incentives and disincentives to actually change this market system. That's my view on this. And finally is that we must make health the face of this challenge, because it's about lives. It's not just about carbon credits. It's not about counting metric tons of carbon. It's about counting lives. The more we pollute, the more lives we lose. And these lives are being lost by the people driving this and fueling this crisis. So we have to put health as a human face of this challenge.
Thanks very much, Gitunji. I've got lots of questions coming in through the chat, and I'm going to come to those in a few minutes, but I'm just going to squeeze in another answer to this question and then another question to get your thoughts on. So Omnia, on this question about fueling the fire, the trajectory as you see it, you've been so involved in the COP process. How do you see things?
So I see three different factors around the fueling that we are seeing by countries. The first is around the deep involvement of the fossil fuel industry, especially in spaces like we see at COP. Last year, we had over 2,400 fossil fuel lobbyists being present and being involved in the negotiations. And also, outside of the COP negotiations, there's a lot of health and climate disinformation that is also fueled by the fossil fuel industry, which puts the climate and health crisis in a complexity lens, which leads to disengagement by even the public of seeing the climate crisis as a health emergency, as a priority, particularly for their developing or developed nations. The second thing, which Gitunji and Patrick highlighted, is the business case that is needed to make for example, adaptation versus the business case and the return on investment that can be easily made for mitigation. And this is why the health argument and the quantification of the healthcare or the health benefits is so critical to be used in developing that case for investment. I think the last factor I see, especially at COP, is what is the dominant strategies that countries always choose, and when are countries going to prioritize healthy climate action and the health of their people as the dominant strategy, and how can countries compromise when it comes to supporting, investing in funds like the loss and damage fund, putting more pledges into that. And in the next 2 weeks, we're going to have a huge discussion around climate finance, but also how can we mobilize the necessary funding for the countries that need it the most to both adapt and transition towards the net zero target that we all aspire to.
Thanks, Omnia. Your last point very much resonates with Patrick's about health missing in action. Maria, I'm going to come to you, but not on this question. I'm going to ask you about the third area that this year's report focuses on, and that's the opportunities. The opportunities and the progress in those opportunities to build an equitable and healthy future. And I'd like you to, if you could, answer a very simple question. Are you hopeful?
You know, you cannot work on public health if you are not hopeful, if you are not a pathologically optimistic person. So yes, Richard, I am. And I am because, not because we have resolutions, we have COPs, we have health days, we have reports and all of that. I have hope because yesterday I was with 300 people working at the hospital level here in Brazil, putting in place some actions to decarbonize the health system. Those are the front, the front line and doing something. I have hope when I see people telling me, young people saying, well, you know, I'm recycling, but I see all of those rich people going with a private jet. So what's the point for me to keep doing it? And then still they are right, of course, but they keep doing it and mobilizing others and doing very provocative actions and changing the mentality and the culture of the parents. So my hope comes from the fact that this will be popularized, glamorized. People will understand that it's very much about health. And there is nothing against the economy, as was saying by Marina before. At the contrary, we could have a healthy, sustainable, attractive, and a more, a better economy for all of us. And it has been demonstrated. Look at some countries around the world. So I keep hope because I have hope on the people.
Okay, very good. A one-word answer, Omnia, hopeful, yes or no?
Yes.
That's fantastic. That's it. I'm going to ask you another question in a moment. Gitinji, yes or no? Hopeful?
Got it.
Yeah, right. Okay. Now look, I'm going to ask a couple of questions that have come in through the chat. And the first one I'm going to just direct straight to Marina, because all the people on this webinar, it's probably likely that we all agree with each other on the importance of climate and health. So the question is, what is the strategy to share these findings beyond the usual suspects so that we can get to this word that is the number one word for today, and that is action? So what's the plan? What's the plan, Marina?
Yeah, absolutely. We have to stop speaking in silos in our own echo chamber. So what we try and do quite a lot, and we encourage everyone to do, is to reach out through your social networks, reach out through your work, through your family, through your friends, and spread the word in however way you can. We have to make sure that this evidence is loud and clear. And for those working in organizations, as we do with Lancet Countdown, ensuring that you're reaching out to people that can influence public opinion, that you can inform those that have loud voices to understand the evidence, because the evidence is sometimes not clear to those that can actually spread the word. So we have to bring that clarity. We have to defend the science. And those of us in a position to do so have to take that as a key goal here, as our priority.
Fantastic. Yes, indeed. And actually, I just have to do a shout out to somebody who's not on this in this webinar. And that's Alan Dangour from Welcome, because Alan made the very important point recently at the World Health Summit about how Welcome is funding not just for people like us to write papers and publish them in journals, but how we engage in changing policy. And that's a big strategic shift for Welcome, an important one, and we all need to support it and back it. Now, another question from the chat, and that is, who would like to discuss this question? How the impact of heat is different between women and men. And this is beyond risks in pregnancy. This questioner wants an answer to that. What are the differential impacts of climate on women and men? Who'd like to go for that one? I'm just going to leave this open to somebody to jump in.
I can jump in if you want, Richard, with some very basic information, but I'm sure Sonia can provide a bit more here. It's quite difficult to understand the impacts without taking into account different behaviors and different underlying conditions. But one thing that we see is that men generally are quite vulnerable to extreme heat exposure because often they have a higher burden of disease from those predisposing underlying conditions like cardiovascular disease, lung disease. So we're seeing that skew towards men. That doesn't mean that women are protected. Obviously, those with underlying health conditions will always be most at risk.
Thank you very
Richard,
much.
can I say something? Just a small thing, but when you look at occupational health aspects, I will remind you that most of the women in low developing income countries, they are not part of the formal working sector, and therefore they have less rights and less protection in that sense. So when you need to work outside and there is a heat wave, the woman will not be protected by the formal sector occupational health standards and will be most affected in that sense. I mean, on the discrimination probably on gender based.
Thank you. Thank you. We've got 2 minutes to go. In fact, 1 minute to go. And I'm going to ask you the simplest question of all. Why are we not addressing the root cause of the economic system that pursues infinite economic growth as a result of an infinite economic growth in a finite planet and has no interest in well-being or health? So what about the fundamental problem here? And that's the economic system we have. How are we going to address that?
Well,
you must have an answer.
Yeah, because this
Well,
is the issue.
30 seconds to save the planet.
30 seconds is that this is a market problem. We must have market solutions. And the best market solutions are tools for incentives and disincentives. And they have to do with financial systems. Loss and damage, pollute and pay, tax carbon. That's it.
Fantastic. What a wonderful panel. Give them a virtual round of applause. And now I'm going to hand straight over now to the Right Honourable Helen Clark, who's going to have a fireside chat with Gina McCarthy. So over to you, Helen.
Well, thank you, Richard, and thank you to all the panel. That was amazing. Gina and I had an opportunity to talk a little in a green room, virtual as it were, and I have a feeling that Gina's going to orient us very much to turning evidence into action and getting on and making the most of the opportunities to make change. So let me just say by way of introduction to Gina that she has been just such an amazing voice on climate action, clean energy in the United States of America. The first ever White House National Climate Advisor from 2021 to 2022, having, of course, previously served as the 13th Administrator of the Environment Protection Agency from 2013 to 2017. So she has served at very high levels of government. She knows how to get things moving. And Gina, we obviously see your touch in the Inflation Reduction Act, which is, I think, the biggest ever piece of legislation advancing climate action and clean energy in the United States of America. So, Gina, you've had a look at the headline of the findings. We've been listening to the panel. How would you go from where we are and these findings to how we give people and communities hope that there can be change for the better, which will be good for their health, and that they can also be part of that change, part of driving that change? Give us a note of optimism.
Well, Helen, first, let me say how honored I am to be here with you and to thank you for all of the work that you've been doing for so long. And I so appreciate it. And it's just an honor to be with you. And secondly, let me thank everybody for doing the Lancet Countdown. It is a tremendous piece of work that really should help guide how we move forward, not just in this country, but well beyond. And so I want to thank all of those folks who ground this out. But Helen, you're right. I am optimistic. I am hopeful. And frankly, I'm going to stay that way no matter what anyone says, because I don't know anything better on how to make change happen than by lifting people up. So really my goal over the past few years has been able to get people, yes, to recognize that the climate is changing, but to not use that as the framing for action, because people need to know that there's hope and opportunity. And frankly, there is. Because we have all of the technologies, the products, the processes that we will ever need to fix this climate problem. But what we need more now than anything is people having the hope that it's going to better their lives. We have to stop focusing on greenhouse gas reductions as the optimum way to talk about the challenge ahead. And we have to talk about people's health. We have to talk about clean air. We have to talk about the opportunities that clean energy brings to them to actually drive a different economy, to start weaning off of fossil fuels, which will make our lives and our health better, and how we can actually move forward local communities, not just in the US states and not just internationally at the country level, but start driving that hope and potential from the bottom up, because that to me is how change happens. I've been doing this stuff for decades, and I love federal government actions, but honestly, you know, Helen, as well as I, change comes from the bottom up. And if we can build that hope and that opportunity, we have the best chance ever of delivering our kids and grandchildren the kind of future they deserve.
Gina, we've obviously all noticed, the impact of these horrific hurricanes in the south of the USA, Hurricane Helen or Helene, whatever, just recently taking lives. I mean, how is this impacting on the consciousness of the US people that there is a need to do something? Are these recurrent bad weather events sort of galvanizing, the need for action, or is there still denial in the face of it?
That's a really good question, Helen. And in my judgment, it is not making the effort for systemic change happen. When I was working for President Biden, we made decisions about moving forward on two different paths. One was the bipartisan infrastructure law. Now, that was a path to try to understand and improve resiliency and adaptation. You can't just build new bridges. You got to recognize how the world is changing, our climate impacts, and build it to weather those storms. And so I think many of us have seen these catastrophic challenges like Helene and others that are really showing people that change is afoot, that they have to start looking at these issues with the kind of care that science and good technology can bring to the table. But I don't think in our fractured society right now that you see just as many people denying climate science as ever. And so we have to stop, and step back, I think, and look at how we, instead of talking about the climate disasters, we have to talk about how we build, how we rebuild. The Inflation Reduction Act was an acknowledgement that we had lost our manufacturing sector in the United States. We were faced with COVID and challenges that, frankly, the prior administration before Biden could not and would not deal with. And we had to change that framing. We changed that to a framing of, let's put some money into the system so that we could actually start rebuilding our communities again, that we could actually show people that it would matter to them and make their lives better, that we could actually move forward to attract private investment in with tax credits and rebates and other things. And we could set aside at least 40% of the Inflation Reduction Act resources to ensure that it was going to the communities left behind. That is how we fashioned this. This is how we talked about 330,000 jobs already grown, 1 million likely to be surpassed by the end of this decade. This is how we got $910 billion out there to attract the investments from the private sector world so that we could move forward. It had to be, we're rebuilding, we're going to protect people, we're going to make sure that we are bringing hope and opportunity to every sector. And frankly, how equity could be one of the major considerations, because we had seen how many communities had been left behind for decades and decades, if not centuries. And that had to be corrected.
So all the time, bringing it back to communities, bringing it back to people's hopes and aspirations for their health and well-being, and engaging them as part of the journey. That's really what you're telling us.
That's right. And honestly, Helen, it's the only path that I have that allows me to stay hopeful and opportunistic. Because, I've been working in government, Helen, and I know that you've been working in these sectors for so long, but for 40 plus years, I've been working at the local and state and federal level. I've never seen change just happen at the federal level. It had to be demanded from below. It had to be tested for local communities, cities, and governors and mayors. So that's why I'm active in working with Bloomberg as America is all in, because frankly, it's the only way we're going to win. And it's also the only way that you can build people's confidence, get them open to an acknowledgement that our climate has changed, because we have ways to address that for our communities. And so I'm looking forward, hopefully, to, fingers crossed, a good election, and another opportunity really to move forward with additional efforts to actually, not just in the US, but frankly, to meet our international obligation that we have to the world as the richest nation. It's been embarrassing to me personally and embarrassing to everyone I know in the United States who understands about our climate threat, that we have not been able to move forward with the kind of investments that the United States has to make, with the kind of efforts that every government needs to put on the table, that multi-level development banks in the private sector need to join in. All of these things put together, if we can keep hopeful and opportunistic, will deliver a more safe and secure and a healthier world.
Gina, looking at the very important series of reports now that have come from the Lancet Countdown on health and climate, how important is this bringing together of the scientific evidence, updating it every year? How important is it to the policymakers? You've been in the hot seat as a policymaker. Did you look to these reports as a basis for action?
I think it's usually important, not just for the policymakers, but to send clear signals in the private sector. Look, we have been struggling with ideas about climate, about credit markets and other things. And we've been struggling to identify, the opportunities that we need to make with multilateral development banks that really support new visions of the future for countries that need it most. It's been a struggle, I think, all around. But in the United States in particular, it has been simply an embarrassment not to be able to be more rigorously engaged in these international discussions, particularly as the prior administration, the Trump administration, pulled out of the Paris Agreement, dismantled all of our environmental policies and regulations. It did the best they could to stick their head in the sand. But that's changed under the Biden administration, and my hope is that will continue to change. But frankly, as you know, the UN, the UN Development Plan, the program, the UNFCCC, all of us have to figure out how to work together as one world to address this global challenge. And it means that the rich countries need to step up, that we need investments in the developing world and the global south, because you can't just rely on solar panels to take care of the problem in the global south when you have so many billions of people who can't access clean water, who have no access to clean air, who have lots of little kids that are losing their lives because we haven't invested in fundamental infrastructure that you need in order to then turn it into the clean energy revolution of our time. And frankly, Helen, we need to roll back any kind of efforts to provide private sector money or public sector money to fossil fuel companies. Now is the time to start making huge demands on fossil fuels, not just to reduce, but to eliminate our dependence on fossil. We know how much it's burdened our health. That's exactly what the Lancet report points out. This Lancet report is telling us that the time is now not just to use an Inflation Reduction Act, which is great to entice clean energy, but we need to firmly put our foot down on the fossil fuels that is contaminating our country, our globe, and basically causing so much health damage to the people who live in our world. The time is now. We have to stop being shy. We have to start moving forward.
Well, Gina, you're giving us an incredible lift about what's possible if we approach it with a can-do attitude and that we can bring hope to people. Maybe just a final word from you on what you are seeing and hearing from young people who are pretty switched on to this issue.
You know, we were talking about that, Helen. I mean, I am that is what gives me hope. In the US today, women is what's going to make a difference next week, right? This to us is huge. Women are hanging out in droves, understanding the threat to their lives and moving forward. But young people are what is absolutely driving the future. They will take no nonsense about what cannot be done, and they are fully all in. I'm seeing young scientists get together. I'm seeing the civil servants and the federal government and state government and local government binding together to demand the kind of action. And frankly, it couldn't make me any happier as a 70-year-old grandmother of 5 to know that my kids and my grandchildren are going to benefit from the push of young people today. It's relentless. I just hope it getting harder and more difficult for those of us who haven't yet seen the light to figure out how to move for their benefit and ours.
Well, Gina, your words have been a breath of fresh air, and may you continue to encourage us and motivate us to get out and take this evidence and convert it into action. And I probably speak for everyone on the call in saying, let's hope for a climate positive result on the 5th of November.
You got it, Helen.
Yeah. Thank you
Thanks
so
for
much,
everything
Gina.
you're doing.
Thank you.
Yeah.
Thank you. And back to you, Richard.
Well, thanks very much, Helen. That was an inspirational exchange you both had. I'd just like to give a few final, very brief reflections on this webinar, this year's report, where we stand. Because every week we see new news appearing about the impact of climate change on the planet. Just a few recent examples that you will, I'm sure, have read about. The United Nations Environment Programme reporting this month that we're in a worse position this year than we were last year in our efforts to tackle climate change, now heading for 2.8 degrees global warming above the pre-industrial era by the end of the century. Work showing that forest fire-related emissions have nearly tripled over the last 2 decades, linked, of course, to fire-favorable weather conditions, that indicates a growing vulnerability of forests to climate change, and also warning us that these fires are reducing the capacity of our forests to act as carbon sinks. Work that's shown changes to the European North Atlantic jet stream will pose significant risk to food security. And even rapid loss of ice from lakes is accelerating evaporative water loss, damaging water quality, increasing greenhouse gas emissions, and harming ecologies. So it's paradoxical, isn't it, that as a crescendo of alarm is reached with this increasing amount of evidence, those who have the political and economic power remain insufficiently moved to take the necessary action, that word again, to reverse the crisis that we face. So 2 questions. Why is that? And second, what do we do about it? Well, the why question, I think, is at least partly because in Western countries, in Western democracies, there's just too little public demand for that action. In the United Kingdom, where I'm speaking from, only 1 in 10 people believe that climate change is a serious problem for this country to address. And the result of that lack of concern is that oil and gas companies are reducing or withdrawing their past commitments to diminish fossil fuel production, and governments are tacitly accepting that fossil fuels will still be an important part of their national energy mix for decades and decades to come. So what can we do about that? Partly, we need to continue to communicate. and communicate even more intensively. We must never give up on communication. And by communication, I'm talking about the very, very broad impacts of climate change on human health. 500 million children, UNICEF reported this year, living in environments with extreme and unprecedented heat. West Nile virus, the Asian tiger mosquito gradually advancing into Europe. First-time meetings between species, increasing the risk of zoonotic infections, wildfires, fueling air pollution, record sea level rises, destroying coastal cities, and not only direct effects, but indirect effects on health. Erosions to our biodiversity, drying of global water supplies, rising ocean temperatures, retreating tropical glaciers, declining forest resilience, accelerating species extinctions. There's no end to the impacts that the climate emergency is having. But part of the reason for public and political passivity is because people place the economy and health and education and other issues high on their priorities and above climate, and understandably so, because these issues affect their lives in the here and now. And when we talk about climate, even though we are passionate about it, we tend to talk about climate at a distance in time and place. It's something happening to someone else, somewhere else. And so we need to bring climate change to the here and now and make it more immediate. And that is exactly the goal of the Lancet Countdown on Health and Climate Change, to make the threat of climate change real for you today, and to make it clear that we have solutions that are extraordinary opportunities for our economies, as well as for our health and for the quality of our lives. Because the human and the planetary dividends from acting decisively on the climate crisis are vast, absolutely vast, but they're not going to happen without us taking action. It's up to us as citizens to demand those dividends from those with power. So let's make those demands and let's do it now. Over to Marina.
Much, Richard. Thank you so much, Helen, Gina, and all of the panelists for such strong words, for such inspiring interventions. As you've heard, it's the moment of action. We cannot keep on delaying action, and we need to demand the life-saving interventions that will enable a livable future for current and future generations. There's some good news coming from the Lancet Countdown. We have a lot going on internally, supported by the Wellcome Trust, which is our core funder. We're now starting a new phase for the Lancet Countdown. The Lancet Countdown is now moving to a new phase of work in which we will be focusing on how we can best deliver the evidence needed to drive this action, to inform the action needed. Will be driven by scientific rigor as a core standard, as we've always had, knowing that science and rigorous evidence is at the heart of the foundations of good evidence-based interventions. We'll also increase our links with other organizations that can help us increase the impact of our work. So we do want to hear from you. We want to increase our policy engagement, our influence, to ensure that the evidence is acted upon. It makes no good if it's just stuck in the scientific community. It needs to reach decision makers. We want to also help increase our capacity to monitor the links of climate change and health to a level that is most relevant to the worst affected communities, so that that bottom-up action that Gina was talking about can be taken up with the evidence needed to underpin it. And obviously, as you just heard, communications is essential. So we will continue to work on disseminating our findings. So coming up very soon, we'll have the launch of the first Small Island Developing States report of the Lancet Countdown, a crucial report which will expose the disproportionate impacts of climate change of these very vulnerable communities and the enormous gaps still in the capacity to monitor and to respond to those threats. So please stay tuned, visit our webpage, lancetcountdown.org, because we will be announcing there the launch of that first report. And we'll soon be publishing also the report of the Lancet Countdown in China, a crucial part of the world where we do need to see a much accelerated action, and there's some progress also shown in that report. So do tune in on the 5th of November for the launch of that report. More information again in our website. And I'm beyond delighted to announce that we will be opening the Lancet Countdown in Africa. There's already work underway in shaping the local research network in Africa, led by Professor Chris Murray from the MRC, the Gambia. And we're looking for the Lancet Countdown Africa Regional Director, who will be the person leading this effort through local institutions, local research, and local expertise. So we have the opening out in our website. Please do look at lancetcountdown.org and do spread the word. We need to find a great leader for this initiative. We think will be very important and increase representation in the global Lancet Countdown as well, ensure considerations and the knowledge of people in Africa are also taken into account. And finally, to support the enormous amount of work ahead, we will be opening new positions to join us here at the Secretariat. So this will be announced soon. Next week, we will be putting out a call for the head of operations, a crucial role to make all of this happen. So do look into our social networks and our webpage as well. And last but not least, we're hosting numerous launch events around the world. These events bring local communities, decision makers, local researchers together to try to find the opportunities for action, to interpret the results at a local and regional level, and to drive that engagement that is so urgently needed. So do look for your events, near you at lancetcountdown.org. There's plenty of them going to be announced soon as well. And obviously, to support all of this, our data in the Global Lancet Countdown report is generally presented at a global level, but both through our global reports and through our regional reports, we do have a very good level of resolution of data at a country level, which we think is really important to inform national and subnational decision makers in the actions that need to be taken today to protect local populations from the threat of climate change and to tackle emissions with a health lens to improve the future for all. So please do look into our webpage as well for policy briefs with policy recommendations. I'm showing you there the one for the United States of America, and also the data sheets with national level data. They're short data sheets that can be printed and shared as you see fit, that have been co-produced in many cases with leading national policy partners as well. So a huge thanks to everyone who has been involved there. And finally, a huge thanks to you from tuning in, for your attention, for your questions. I wanted to also take a moment to thank the Welcome team for the enormous support that they have given us, for all the guidance on how to improve the impact of the Lancet Countdown, and obviously for the funding that makes all of this possible. So thank you so much to Welcome. Thank you to the Lancet. They're not just a publisher, but they're a partner. They work so hard to ensure that our report is accessible, to share it, to communicate it effectively, and obviously to make it happen every year. So thank you particularly to Richard and to all of the Lancet team for your work in spreading our words and in making all of this happen. And I wanted to thank also the authors, the 122 that contributed to the Global Lancet Countdown report this year, but to the over 300 authors and scientists that contribute to the global and the regional Lancet Countdowns, who add on to the value, who help move our science forward in ways that are meaningful and relevant. And finally, a very special thanks to Hannah Whitcombe, who has put together this event with a lot of work, the Lancet Countdown's communications manager, to all of the secretariat of the Lancet Countdown. You can see them all online, so I won't mention each and every one of them, but they have been working so hard to make this event happen, all of our communication efforts, obviously the policy engagement and the data finding and data communications that also goes behind the scenes. Thank you so much for your attention, and now over back to you, Smita.
Oh my goodness, thank you so much. What an energizing afternoon that has been. Marina, thank you so much for highlighting some incredible opportunities to carry on this great work now into COP and ahead. That was a great panel, going back to Richard's expertly led panel. There were some slogans in there. I'm not sure that this was what was meant by popularizing and glamorizing action. But I felt that some of the things said there could be great slogans to put on t-shirts and just wear everywhere. My favorites were, let's not be complacent. It's time to adapt or die. It's a life crisis, not a climate crisis. Only health can take us out of this. I am definitely getting some of these on some t-shirts. There was also some challenges to the health community. They are to be congratulated, of course, for the amazing work done so far and the greater engagement shown over the last year, but also some questions. Health needs to be front and center, but it was missing in action. That's painful to hear. Why? And ahead of COP, what is the plan? But what is a plan without finance? Some really important questions for us all to consider. The fireside chat with two remarkable women was incredible to hear. Women with such can-do attitudes. And it was incredible to hear that it's women that are taking charge, that can make a difference, and that young people are not standing silently, that they are demanding action for a better future. This optimism is fantastic. As a journalist, it is not always easy to cover climate and health, and I'm echoing Richard's comments here. It is not always easy to get the public, particularly here in the UK and many countries like it, interested, partly because they think it's not relevant to their lives right now, partly because it is hard to hear depressing news and to hear the same messages again and again. That's why this countdown was so different and so important and has had so much success in getting out there and disseminating these findings. Because by focusing on health, health is important to everyone. By focusing on local and national metrics, by putting in all that work of those hundreds of researchers, it has meant that we can tell the stories to all individuals who matter. But also by focusing on the optimism of the signs of progress. This helps us move people to actually listen, to realize that they can do something to change things. And that is the people who vote and the people in power. So thank you very, very much. If you haven't already, you can look at the full link to the Lancet Countdown 2024 report below or at the lancetcountdown.org. And finally, we have heard from some incredible speakers today, experts across climate and health, all with rallying calls towards a healthy future. So let's end with one more extremely important voice. In response to this year's Lancet Countdown report, the UN Secretary General, Antonio Guterres, said, "We must cure the sickness of climate inaction by slashing emissions, protecting people from climate extremes, and ending our fossil fuel addiction to create a fairer, safer, and healthier future for all." Thank you so much for joining us.